Cancer Awareness Session, which is supported by Roche. I'm your host, Dr. Behjat, and today we will be discussing about lung cancer. In 2020, lung cancer was the second most common cancer after breast cancer, with almost 2.21 million cases worldwide. Although prevalent, lung cancer is commonly misunderstood. So, to help us get to the truth of the matter, we will be addressing myths and misconceptions about lung cancer. And to share his invaluable insights on the topic, I have with me Dr. G. Vamshi Krishna Reddy, who's the Director, Oncology Services, Hemato-Oncology. Welcome to the discussion, Dr. Reddy.
Yeah, hello, good evening.
Good evening. Thanks for being with us and, being a part of this awareness session. So today we'll be focusing more about the myths and misconceptions that are there when we talk about lung cancer. And the first myth that is, you'll find people talking about is how lung cancer and smoking is, related. Many people say, I did not smoke a single cigarette in my life, and yet I got lung cancer. So please enlighten us on this myth that, that connects lung cancer and smoking.
So I think for the first part, whether lung cancer is caused by smoking, yes. It is proven beyond doubt that tobacco smoke is one of the commonest causes of lung cancer. So it has been proven across the world through various trials that cigarette smoke is a cause for lung cancer. And for that reason, the smoke is classified as a carcinogen, which is a cancer-causing agent in lung cancer. And we have few types of lung cancer which are seen only in smokers. Like if someone gets a variety of lung cancer called as small cell lung cancer, even though the patient denies that I did not smoke, we know he has smoked. So there are few varieties of lung cancer which are seen exclusively in smokers. Coming to the next part, which you say is lung cancer, does it happen in non-smokers? So we have this term called as never smokers or non-smokers. This usually is to identify those patients who do not smoke, or they might have smoked less than 100 cigarettes in their lifetime. So lung cancer, we see even in non-smokers, that is to an extent of 20 to 30% of the lung cancer cases we are seeing nowadays. They happen even in non-smokers. So they ask us, sir, we never smoked, and why did I get lung cancer? So it's like those who smoke, they get lung cancer, that's accepted. But those who do not smoke and they get lung cancer, they feel terrible that, okay, why did I get it?
Right, Dr. Reddy, very rightly you've pointed out. Coming to another myth that we have seen many people believing is that, it affects only older individuals. That is, after a certain age, you are more susceptible to that kind of cancer. Though, nowadays we are seeing that the average age has, declined in that sense that younger people are now getting lung cancer. So what about that misconception that no, people do not go for early detection and even after having symptoms because they feel that I am too young to have this kind of a problem?
Yeah, lung cancer can happen at any age. I think the youngest patients which we are seeing nowadays are in their 20s. So I think what was shown or was thought earlier was that it usually happens in older age, that is 60 and above was the usual myth. But I think what we are seeing nowadays is quite contradictory to what was seen earlier. And these are those exceptional patients who probably have some genetic mutations where probably most of them are not even attributable to smoking. So these are a different set of patients whom we are seeing in a very young age. So we have few genetic susceptibility genes which probably are altered in these people, which is causing them to have this lung cancer at an early age. But keeping this aside, majority of the patients we see with lung cancer are probably, in India, we see most of the diseases a decade earlier. So average age should be sometime between around 50 and above is what we see for majority of the patients diagnosed with lung cancer. So age, definitely as we age, the older age increases the risk of lung cancer, especially in smokers. But for non-smokers, age criteria is usually not followed. So if we have a suspicion, probably getting a biopsy, if there is any lesion in the scan, it's most prudent way to diagnose the lung cancer early.
Dr. Reddy, you have talked about biopsy also, and when we talk about
Recording in progress.
And we usually take a biopsy. So getting a biopsy is a doctor's headache, so leave it to the doctor. But what you have to understand is biopsy is very important. There is no way to beat biopsy. Yeah, there are few patients whom we usually try to treat by taking a liquid biopsy, that is by taking a blood sample. But that is for those with a proven lung cancer. As of today, this technology is available only to detect few mutations in the cancer. So I think this is mainly for those patients who are diagnosed with lung cancer, not for everyone. So for today in 2024 February, we'll still be going with a biopsy of the lung cancer doubtful area to get a tissue and process it for further targeted therapy or immunotherapy or whatever tests we do. It's mainly to plan the treatment for the patient. So without that, we are like traveling in the dark. So you'll not know where to go. You don't know the direction. So the prognosis is not that good.
Dr. Reddy very rightly have pointed out how, that is the basic test that you have to go, for detection. Coming to the symptoms and signs, because many people, feel that it is a lung cancer is a disease that is always symptomatic. Though they would say after the test, "Arey, mujhe koi symptom nahi tha, still I got the disease." So this is another, blockade that people have, that until and unless you have those symptoms, you should not go for detection or diagnostic tests or screenings for that matter. So what would you tell them when it comes to, whether lung cancer is symptomatic or always asymptomatic? What do you have to say about that?
Yeah, most of the times lung cancer symptoms are confused with the common diseases which we see. Because anything in the lung, any mass or any lesion will cause common symptoms like cough, breathing difficulty, or at times pain, rarely blood in the sputum. So these symptoms are seen with other diseases also. So unless we get an imaging, we may not be able to tell what exactly we are dealing with. So what we usually suggest as doctors is, yeah, you might be having a common cold or cough. Those are quite common in our population. So if it is not coming down or subsiding within a week or two, that's when you need to worry. That's when the alarm bell should ring. Yeah, I think something unusual. Then you need to see your doctor, who probably will get a scan to see if there is any lesion in the lung, get it test right away, probably biopsy, and then see. So the symptoms which we should be looking for is one, cough, persistent cough, going beyond 2 weeks, not coming down with the regular medications which your physician is advising. Second, breathlessness, which is disproportionate, lying down or patient is not comfortable while breathing. Rarely we see blood in the sputum, chest pain, and rarely we see symptoms when the tumor has spread beyond the primary site. So it depends again where the tumor has spread. And most of the patients also do complain of loss of appetite and loss of weight, but this happens in advanced stages. So we need not wait till that stage to diagnose lung cancer. So any common symptom which is not coming down in 2 weeks or so, we need to worry. Another thing is if you complain of recent change in voice, the hoarseness of voice. So that is also quite a common symptom in lung cancer, which should be investigated if it is persisting for 2 weeks or beyond.
Right, Dr. Reddy. If we talk about the, cure or even the treatment journey, there is a common misconception amongst people, because when they hear the word cancer, it is like it is something which cannot, they feel that it is something which is not curable, or, many believe that, array lung cancer hai, to matlab it's like the end of the world for them. So how would you, convince them, or what message would you give them to, because it is said early detection can have a great outcome as far as your health is concerned. So what advice would you give them, and especially when we talk about the different stages, at what stage do they need to go for which treatment?
So all of us know that as we have with other cancers, even lung cancer has stages. So it is staged from stage 1, 2, 3, and 4. Fourth is the advanced stage. So in lung cancer, we have in 3 also we have 3A, B, C. So anything beyond 3B is called as an advanced stage in lung cancer. So based on the stage of lung cancer, your treating doctor will decide of how to deal with it. So for early stage lung cancers, like stage 1 cancer, where there is a small lesion, we use the role of surgery. So we have various techniques in surgery where we go and just remove that lump or lesion, whichever is seen in the lungs, by a simple modality of surgery. And there are times we might have few lesions which might not be amenable for surgery. So we usually use both the chemotherapy and radiation for this type of tumors, which probably might be in stage 2 or early stage 3, we call these tumors. We usually try to treat with chemotherapy and radiation. And as I said, advanced lung cancer tumors, most of the times, we usually treat only with medical management. That is, either you give a targeted therapy or immunotherapy or chemotherapy. So we have a whole new basket of medicines in lung cancer, which probably are used to treat lung cancer. So people, yes, do ask us, we have diagnosed with an advanced stage lung cancer. What do you see? Why waste? Let me pass away peacefully. Let me not take any treatment. So these are the common things which usually pass through a person's mind when they're diagnosed with advanced stage lung cancer. So probably all of us, most of the oncologists do have patients who have crossed 5 to 10 years for an advanced stage 4 lung cancer and taking medications. So it's not a myth, it's a fact. So we don't call it a cure for a stage 4 cancer, but we are seeing this long survivors. So we don't see this long survival in a kidney failure patient or a heart failure patient or diabetes or hypertension. None of them are cured. Okay, so as of now, what we are seeing is lung cancer is turning to be treated as a chronic disease, just like what we are doing with a diabetes or hypertension, or like what we are treating like a chronic kidney failure, like those on dialysis. So it depends again, what medicines we give will depend on the patient's biopsy type and the mutation they harbor. So the treatment is not decided. It's not like a one shot fits all approach. So as of today, most of us in lung cancer, it's one of the area where we are choosing the personalized medicine or precision oncology, where we have a lot of tests available and also the same number of medicines available. So please go ahead with the biopsy, get it tested. You might be fortunate to just have a tablet which might be helping for you. So just keep pop a tablet, very much comfortable, and you might cross 5 10 years. So why you want to miss that survival advantage for a lung cancer?
You have pointed out, coming to the preventive aspect of the disease, because there is a lot of varied opinions on that also, because whether it is something that can be prevented, or you can switch to a preventive lifestyle, and that can help you, in because when we talk about even the air today, because many people say that, Arey, smoking nahi karte ho aap, but you are still living in a very polluted city like Delhi, for example. Does that also have an impact on, and what are small lifestyle changes that people can make to move towards that preventive sort of a lifestyle?
Yeah, I think what you have rightly pointed out is smoking is one thing which all of us know, and I think most of the times we tell avoid smoking, so that's a easier job, at least in telling. But as I said, we see 20 to 30% of this lung cancer happening in non-smokers. As you said, like this might be the patients who are non-smokers who might be having this second-hand smoke. So most of them might be having their spouses who are smoking. So that's another common thing which probably we need to remember. So smoking does not mean that the person directly smoking. It's your colleagues or your friends or the close peer group who is smoking around you. Even that may attribute to second-hand smoke. Next, as you rightly said, is the air pollution and the environment around us. That is very difficult to change, like in places like Delhi, where we have the highest air pollution, how to prevent lung cancer in them. So there is no medicine or a pill to prevent lung cancer. It's only to avoid the pollution. So now how to avoid, I think we have various level of purifiers. One is trying to keep your air around yourself very like less pollution, and probably try to keep it as healthy as possible. Try to get natural source of oxygen, like try to plant trees around, be around them. So there's a few things which probably will be suggesting. So as of now, there is no pill or any medicine to prevent lung cancer. It's all to prevent the environmental exposure or the occupational exposure which you need to prevent. There is also like the environmental exposure in your occupation, like the asbestos, we have the radon gas, we have the radioactivity. So all these are man-made and these can be controlled by man himself. So for lung cancer, other than the tobacco smoke, rest all is human-made carcinogens. So we need to avoid these carcinogens to prevent lung cancer. And what exactly to be done? Probably look around, take a minute, breathe around, see what is going around you, and try to at least make a difference by how to decrease the exposure to this.
If we talk about the treatment journey, Dr. Reddy, because many people believe that you go, if you have the problem, you go to a doctor, get yourself operated upon, or whatever the mode is there, to treat the disease, and you come back, and then you do not need to go up for follow-ups, and so once the cancer is treated in a patient, when we talk about lung cancer, what is the follow-up journey like? Do they have to come back for every 3 months, 6 months? What are some of the changes that they must inculcate in their daily lifestyle, diet? What is the whole plan like? How does that work?
So for any patient who's diagnosed with lung cancer, we usually have a follow-up plan based on the stage. So for the early stage lung cancers where we are trying to achieve a cure, we usually treat them either with surgery or radiation, and later the follow-ups will be every 3 months for the first 2 years, and later we have every 6 months follow-up. So what we'll be trying to look at is whether this person is going to have a relapse or recurrence. So that's the most important thing what we'll be trying to see. So we usually don't prescribe any medicines. It's only to see for any warning signs which probably might point to a relapse. So this is the first thing which we'll be doing for the early stage lung cancer. For the advanced stage lung cancer, it's not like the treatment is done for them. They will be on some medication for the rest of their life. As I said, it's a chronic disease. So like you treat diabetes or hypertension, you will be on these medicines for the rest of the life. So the follow-ups will depend from the medicines we are giving. So few medications we follow up every 3 weekly, few we take every 2 monthly or 3 monthly, based on the type of medicines we are giving. So for advanced stage lung cancer, the follow-up protocol will be decided based on the medicines you are being given to treat. So then later, once we are off treatment, like we have few patients who are on immunotherapy where we treat them for 1 year and we stop the treatment even for stage 4 lung cancer. So for these patients, we usually have a close follow-up of once in every 2 to 3 months, see again for any warning or danger signs in these people. So the follow-up is mainly to see that they are still holding good and they're not having any relapses.
We will be coming, though we have covered most of the risk factors, but I would be coming to that also in the later part of the discussion, talking about that, though you touched upon it briefly in the beginning, also the types of lung cancer. If you could just enlighten us on the two major types and how they are different, what are the risk factors for each in detail?
So we have mainly two different types of lung cancer. One is small cell lung cancer, other is non-small cell lung cancer. So for the part of our discussion, we'll just see which part of the type is the patient diagnosed with. Main reason is the small cell lung cancer is bit aggressive tumor. The prognosis is bad for this variety. The small cell, bad prognosis. And it happens only in smokers. So smoking, small cell lung cancer. Usually we treat again this stage depending on the type whether it's limited stage or extensive stage for the small cell lung cancer. So they might be treated either with a surgery or radiation. And we also add immunotherapy for the advanced stage with chemotherapy for this. The other variety we are talking about is the non-small cell lung cancer. In non-small cell, again, we have subtypes like adeno, squamous. So it's all to decide what drug we are going to give for these people. So if it is adeno, which is a commonest variety which we see in majority of the non-small cell lung cancers, the treatment is dependent on the NGS testing or the mutation testing which we do. So based on the mutations, these patients will be given treatment in the adenocarcinoma variant. Squamous cell usually in smokers do not harbor many mutations. So what exactly is this about is we'll know how this person is going to behave, what drugs might work for this person, and what are the tests we are going to order. So all this will happen only if you're getting a good biopsy sample. So that's the reason we suggest that the biopsy is the primary important thing in diagnosing and treating a lung cancer patient.
Right, Dr. Reddy. Coming to the risk factors, though we have covered most of them, occupational hazards, how, of course, when we talk about smoking, because I have seen people saying that I've smoked for years and there's no point in stopping now. Like, is it going to help me? So if we talk about the risk factors with a focus on, thinking like this, ke, ab is age mein ya itna smoke karke chhodne se, is it going to help me now? So what advice would you give to such people?
So it's never late to stop smoking. So the risk increases as the number of pack years increases. So I think we did not touch about the screening test for lung cancer. So that is totally dependent on the number of cigarettes smoked. So if someone is smoking a pack of cigarettes every day, uh, we calculate number of years. So a pack of cigarettes a day for 10 years, it's less risk. But if we are smoking the same thing for 20 years, the risk of lung cancer increases. So number of pack years of smoking is very important. So if it is 20 or 30, it's going beyond that, it's very bad. So number of pack years depends on how many cigarettes you are smoking and how long you have been smoking. So as the pack years increases, risk of lung cancer increases. So the person who thinks that I'm smoking and did not get lung cancer needs to rethink again that the pack years increases, definitely there will be a higher chance of lung cancer. Yeah, we do see patients who have smoked for 30, 40 years might not get a lung cancer, but that's a very small population. Majority of them do die of other diseases before they get lung cancer. They might die of a stroke, they might die of a MI. So we are not seeing these patients. The percentage of population, definitely if you take 100 people who are smoking, heavy smokers, none of them make it beyond 60, 70. Only very few people cross that. So they die of other causes. So we don't exactly see those patients crossing a long time. So it's never too late to quit smoking. Definitely no level of smoking is safe smoking. So smoking 1 cigarette per day or two per day is also not safe. Let's totally avoid tobacco smoke, and when to quit, earlier the better. How to quit is a very difficult thing. We have various tobacco cessation programs going. It leads a lot of motivation. It's easier said than done. It starts with the person himself who needs to understand that this is bad. And unless the person is motivated, nothing is going to help.
Self-motivation is very important for that matter. And coming to, since we have discussed a lot of myths, but you have, as an expert, you must have seen, in your practice also, people coming to you with different kinds of misconceptions or, doubts when it comes to lung cancer. If you could just give us some examples so that our, audience get a clarity on those things, that what are some of the, uh, problems or critical questions that patients come to you regarding lung cancer?
Yeah, I think most of them do come to me for tests to prevent lung cancer, or they'll ask me to just screen for lung cancer. So as of today, we have this CT scan where we usually use the low dose of the CT scan because we also need to avoid the harmful radiation from the CT scan. This is recommended only to those patients who have 20 pack years or more of smoking, and at least they should be above 50 years. Okay. So it is from 50 years, probably when to stop. It's with the annual, every year we do the CT scan for these heavy smokers. So the test which we do is the CT scan. And yeah, if someone who has smoked just a pack of cigarettes for 2 years and asks for a scan, it's not right. We might do the scan, but we are unnecessarily exposing them to radiation. So first one, what is the most important point is there is no test to identify lung cancer in all the general population. We only suggest the CT scan for high risk patients, that is the heavy smokers. Second is I have stopped smoking 5 years back. What is my risk? So once we stop smoking, the risk remains the same till at least 15 years. So still you are treated as a smoker. So people come and tell, I stopped smoking, sir. Okay. How long? 1 week back. That is not counted as a non-smoker. So non-smoker is someone who has smoked less than 100 cigarettes in their lifetime or less. We call them ex-smokers. Ex-smokers is those who have smoked heavily but have stopped in the recent past, and the duration depends again when they stopped. So if you are stopping at least 15 years or prior, then their risk comes to the normal percentage. So a risk is carried even 15 years after you have stopped smoking. And the commonest myth which we see is once someone is diagnosed with lung cancer, as I said, whether to go ahead with the treatment or not. Yeah, definitely we trust us. A good number of patients who have done so many wonderful things once they are diagnosed with lung cancer, they have made the life so much comfortable for themselves and around. And none of the treatments is that toxic that they'll be bedridden. We have very good targeted agents which make them feel as normal as possible. So there was one patient of mine who was a professor who wanted to see his daughter's marriage when he was diagnosed with a stage 4 lung cancer. And I think I saw him yesterday. He came with his grandson who is now 2 years old. So I'm talking about he was just worried whether he'll get his daughter married or not with his lung cancer. Now he has come with around 4 years survival. And other good thing is this patient received only immunotherapy. I did not even give chemotherapy. His test showed some PD-L1 was very high. So I gave him only one drug of immunotherapy. And unfortunately, for financial reasons, he received only 6 months of doses. So where he should have received at least 1 year, I only gave around 8 doses of immunotherapy. And with these 8 doses, he's now surviving happily with no evidence of disease after 5 years. And this is for a stage 4 lung cancer. So there are so many brighter stories around us, which each of us as oncologists will be seeing. Please try to share these positive stories. Don't get carried away by the negative stories, which is probably more prevalent in the net and web. Try to avoid and stop propagating this news of that lung cancer is not totally treatable. It is treatable. Yeah, definitely it may not be curable for advanced stage, but we have great survivors who are doing extremely well with this dreadful disease, which is now turning into a chronic disease.
That was indeed a very inspiring story, Dr. Reddy. We are now short on time. It's almost 5:30, but I would still want to, take a one takeaway message for all our audience, especially when it comes to smoking. What advice would you give to our viewers, especially the younger generation, how, on avoiding the major risk factor for lung cancer before we call it a day?
Yeah, I think the first thing is in India and throughout the world, it is proven that lung cancer is caused by tobacco smoke. So there's nothing to discuss beyond this. So all the young people don't make it a fashion trend by smoking. I have seen more women smoking now than men. That's a bad trend which is catching up with the younger generation. It's more harmful in women because probably in men we see only lung cancer, but in women the cancer of the breast, other organs increases by much higher fold. So the younger generation, both the girls and boys, avoid smoking, don't go near smoke. And I think also the other culture which the government has banned is the hookah and the vaping. So yeah, these are also not safe. Just for the sake of giving company and not smoking, don't indulge in these newer habits of smoking and vaping. All these are harmful, man-made, toxic things. So please don't go or make yourself a servant or of you get addicted to all these bad habits. And have a healthy lifestyle. Try to have more trees around you. Create a more natural environment. Try to decrease your exposure to the pollution. Now do your part to avoid the pollution. Try to do carpooling. And yeah, I think diesel fumes are the most dangerous, so I think we should try to avoid the diesel vehicles. That's one thing probably which we can suggest. It's a broader area. I think most of the Western countries are moving towards petrol vehicles or the electric vehicles. So have a healthy lifestyle, avoid smoking, and get yourself checked if you are having any symptoms which are not subsiding in 2 weeks or more. Get yourself screened if you are a heavy smoker, and also try to avoid friends who are smoking. So that's the second hand smoke. So stay healthy, stay safe. Thank you.
Thank you, Dr. Vamshi Reddy. That indeed was a very insightful discussion, which I am sure the audience must have cleared many doubts and misconceptions that they might have about lung cancer. And most importantly, today's discussion will inspire them to move towards a preventive lifestyle. Thanks for taking out time from your busy schedule and joining us today for this session. Thank you once again.
Thank you,
Thanks
doctor.
to all the audience for joining us, and keep on following our social media for more updates on health and well-being, and stay healthy. Thank you, Dr. Reddy.